Male physicians in Ontario are more likely to refer their patients to male surgeons over female surgeons. Now, that's according to a Canadian study that analysed nearly 40 million referrals in Ontario. While male surgeons accounted for 77.5% of all surgeons, nearly 87% of their referrals came from male physicians. The study found these differences exist despite both genders being equally qualified and experienced. For more, let's now bring in Dr. Nancy Baxter, senior author of the study and scientist with the Li Ka-shing Knowledge Institute at St. Michael's Hospital. Doctor, good evening and thank you for your time here on CTV News Channel. So tell us a little more in detail about these findings in your study. At what rate did male physicians refer male surgeons compared to females?
Yeah, so, we've done previous research looking at how much male and female surgeons are paid for time they're spent in the OR. And we found that there was a significant difference. So women made about 74 cents on the dollar. But how did that happen? I mean, in Canada, we're paid fee for service. So, if you do a procedure, you're paid for a procedure. And one of the things that we thought might be driving it is, how referrals happen. So in the Canadian system, you see your doctor about a problem, your primary care doctor kind of figures out what's wrong and refers you to, the correct person to help deal with your problem. And so we thought maybe there was something in that connection between the referring doctor and the surgeon that might kind of drive the volume of referrals and the types of patients to male and female surgeons. So what we decided to do was look over a period of time, a 10-year period from 1997 to 2016, to see what the referrals were. So we looked at all the surgeons in Ontario, looked at who was referring them, and then tried to see if whether, being a male referring physician and a male surgeon, female referring physician, female surgeon, whether that influenced that. It really shouldn't. So referrals should happen because, we have the three A's we talk about with referrals. So availability, ability, and affability. So, how your patient satisfaction is, how able you are, how competent you are to be able to do the procedure, and whether you have the time to see the patient. None of those things have anything to do with gender. So when we looked at it, what we found actually was that gender did drive referrals, and they particularly drove referrals for men. So men were more likely, male referring physicians were more likely to refer to male surgeons, about a 32% more likely. Women referring physicians were slightly more likely to refer to female surgeons, so about 2% more, but over time that went away. So in the later parts of the study, they weren't more likely to refer to female surgeons. So there seems to be a bias, a bit of an old boys club in medicine, and that really affects both, the lives and livelihood of female surgeons, but it also affects patients. So if you have, a significant number of surgeons that are underutilized because of their gender, they're not getting the referrals because they're women. Well, they're talented, competent surgeons, and so that ends up affecting, access for patients. You can't really access fully, a large part of your surgical workforce.
Right. So, Doctor, with what you're explaining, clearly there is a more disadvantage towards female surgeons, and this further widens the gap when it comes to gender in medicine. I mean, that's the impact of what you're saying, as I understand, and correct me if I'm wrong. But also tell us a little more in detail about what are the certain areas where you see that a male physician is referring to a male surgeon or a female physician is referring to a female surgeon? What are those areas of medicine in particular?
Well, we looked at a few things. We looked at whether it was driven by patients, so whether it was, male patients really wanting to be sent to a male surgeon. But, we controlled for that, and we didn't find that really that was the driver. So male referring physicians referred both men and women patients more to men than to women if they needed a surgical referral. So it wasn't really that was the driver. We also looked at the type of specialist the surgeon was, because we thought, that might be a driver too. And what we interestingly found was that when more female surgeons come into a specialty, this bias ends up becoming amplified. It becomes more noticeable. And that's likely because you have more choice. So when you have more female surgeons in a specialty, male male referring physicians are even more likely to refer to the male surgeons in that specialty, which I thought was a very, very interesting finding. We also looked over time to see this was improving, because often you hear that, when more female surgeons get into practice, when there are more of us, then things are going to improve. But in fact, that's not what we found. And probably that's because, as more female surgeons enter the surgical workforce, then there's more choice. So what we found that is it did not improve over time. So this isn't something
right.
that, just waiting for the pipeline is going to help.
Okay, we'll have to leave it at that, but some very interesting findings indeed. We'll have to leave it. Dr. Nancy Baxter, senior author of the study and the scientist with the Li Ka-shing Knowledge Institute at St. Michael's Hospital. Thank you once again, Doctor.
Thanks for your interest.